Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
messed up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
on track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case, plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week. But keep in mind, we now have this in New York State, right? The person who tested positive was only the 32nd test we've done in this state. That is a national scandal. They're testing 10,000 a day in some countries, and we can't get this off the ground. I'm a practitioner on the firing line, and I don't have the tools to properly care for patients today.
Good morning. My name is Deborah Berger. I've been a registered nurse for 46 years in Sonoma County, and I'm president of National Nurses United and also president of the California Nurses Association. I'm going to read a statement from one of our quarantine nurses who works at a Northern California Kaiser facility. She chose to share her experience anonymously, but she is hoping that her story can be elevated to raise public awareness about concerns for the coronavirus response. She said, "As a nurse, I'm very concerned that not enough is being done to stop the spread of the coronavirus. I know because I am currently sick, in quarantine, after caring for a patient who tested positive. I am awaiting permission from the federal government to allow for my testing, even after my physician and county health professional ordered the test. I volunteered to be on the care team for this patient who we knew was positive. I did this because of all the recommended protective gear and training from the employer I thought was being provided. I did this assuming that if something happened to me, of course I would be cared for. Then, what was a small concern after a few days for caring for this patient became my reality. I started getting sick. When employee health told me that my fever and other symptoms fit the criteria for the potential coronavirus, I was put on a 14-day self-quarantine. Since the criteria was met, the testing would be done, and my doctor ordered the test through the county. The county officer called me, verified my symptoms, and agreed with testing. But the national CDC would not initiate the test. They said they would not test me because if I were wearing the recommended protective equipment, then I wouldn't have the coronavirus. What kind of science-based answer is that? What a ridiculous and uneducated response from the department that is in charge of the health of this country. Later, they called back, and now it's an issue with something called the identifier number. They claim they prioritize running samples by illness severity and that there are only so many to give out each day, so I have to wait in line for the results. This is not a ticket dispenser at the deli counter. It's a public health emergency. I'm a registered nurse, and I need to know if I'm positive before going back to care for patients. I'm appalled at the level of bureaucracy that's preventing nurses from getting tested. This is a healthcare decision my doctor and my county health department agree with. Delaying this test puts the whole community at risk. I have the backing of my union. Nurses aren't going to stand by and let this testing delay continue. We are going to stand together, so we can make sure that we protect our patients by being protected ourselves. This concludes this powerful statement by our quarantined nurse,